of our members. Our first presenter who will be speaking to us on overview of NCDs in Ghana is currently the acting program manager for NCD program control at Public Health Division at Ghana Health Service. She worked in clinical care at both primary and tertiary levels of healthcare in Ghana, and is currently involved in development of policies, strategies, and guidelines, as well as capacity building for health workers in prevention and control of NCDs. She is the STEPS Survey Coordinator and the country lead for WHO PEN implementation in Ghana. She's also a member of the Stop NCD Global Health Research Centers collaboration. Her name is Dr. A4H, the acting program manager for the NCD program in Ghana Health Service. Dr. A4H, thank you so much for this opportunity. Kindly unmute and start your presentation.
Okay, thank you very much. Let me share the screen. So it's a real honor to be here today. And is my screen visible?
Yes.
The state of NCD in Ghana. Okay, thank you very much.
Yes.
And I'm grateful for the opportunity to be present for today's webinar. And I'm hoping that, as usual, it will be a great learning experience for all of us, and we'll be able to share ideas on the prevention of NCD, especially with respect to the way forward with sugar sweetened beverages. So my presentation is a brief overview on the state of NCDs in Ghana. And let me have the slideshow. A brief outline. I'll be looking at the introduction, the risk factors, morbidity, mortality, services available at the various levels of healthcare, and then briefly touch on a few national structures we have, consider major challenges, and the proposed way forward. I'm sure we are all aware of what NCDs are, and for Ghana, we prioritize the NCD4, which are the cardiovascular diseases, diabetes, chronic respiratory diseases, and cancers. Beyond that, we also have some NCDs that have been categorized as NCDs of special concern, looking at the numbers we have in Ghana. These are things like sickle cell disease, the thalassemias, and then as a huge priority, we consider mental health and then injuries as prioritized NCDs for Ghana. These are not the only NCDs we deal with. However, beyond the disease conditions themselves, we also look at the various risk factors that tend to contribute, especially in our policy and strategy documents. Now, for the risk factors in Ghana, giving us a first sense of where we are in terms of the risk factors. Indeed, as I was putting this together only yesterday, my attention was drawn to Prof. Lass and his group's article that they wrote, publication in 2020 that looked at unhealthy eating practices. And this was between Ghana and Kenya, and it was insightful to go through it, considering the topic that we'll be discussing today. Most importantly for me, I thought that their findings on the high prevalence of consumption of unhealthy diets, which they looked at sweet foods, sugar sweetened beverages, or fried foods, and these are the ones they consider that unhealthy diets. The prevalence was more in persons with lower socioeconomic status. Sugar sweetened beverages were consumed in about a third of the sampled population, and in Kenya, it was much more looking at their snacking habits. They had about 75%. And they went on about the other risk factors. However,
Doc, we are not hearing you now.
Made recommendations looking at policy.
So we've lost Dr. Komi. I'm sure she'll come on very soon. And Dr. Fanan, I think I can see you now. So it means that you're able to join with your laptop now.
Yes, I'm sorted. Thank you.
Thank you. So we're listening to Dr. Fakome, and her network got bad, so she's dropped off. I'm sure she'll join very soon, so we can continue with the presentation. So, Mufata guidance, what do we do now? I'm just trying, she's unable to join.
It's very interesting. But I even also had a tough time joining, and so I'm not surprised that it keeps on going up and down.
Can we take the second presentation when she comes?
Yes, we can do that, and we can always come back to her.
Exactly. So then we will have our second presentation come on, that is facts about SSBs, and will be presented to us by Professor Reginald. And then whilst I read his profile, Prof, try and see if you can share your screen.
Can I try get? Can you hear me?
Oh, you're back. Great.
Yes.
All right.
Okay. So maybe I can introduce.
Please introduce Prof. Anand. Yes, please.
Okay. Prof. Reginald Ajete Anand is an associate professor of public health nutrition at the College of Science. That is Kumasi, Kwame Nkrumah University of Science and Technology in Kumasi. He has made major contributions to nutrition research that spans the life cycle, engages policymakers to translate research findings, and authored or co-authored over 200 research publications, technical reports, conference abstracts, and commentaries. His research contributes to building capacity for the prevention of all forms of malnutrition and promoting nutritional well-being, especially among vulnerable infants and young children. It also helps to better understand the drivers of poor nutrition and for shaping the nutrition landscape in Ghana, the Sub-Saharan Africa, and the African continent as a whole. He has monitored and built nutrition capacity through malnutrition e-learning, which he co-authored in 2010, and then training of nutrition professionals. He serves as external assessor, a reviewer or examiner for various nutrition programs. He is evidence reviewer and multi-technical task team member for Ghana's food-based dietary development, resilience of food system lead for the National Food System Dialogue in 2021, and also the lead for the development of Ghana's food and nutrition security guidelines, also in 2021, among others. He was secretary and vice president for the then Ghana Nutrition Association and a governing board member for the now merged Ghana Academy of Nutrition and Dietetics. Prof. Annan has served as consultant for the Welfare Organization, UNICEF, IAEA, FAO, and the USA. I don't know about others, but I'm poised this evening to enjoy a great session with him. Welcome, Prof. Annan, and thank you for accepting to be on this program.
Thank you very much. Please, can you all hear me? And also, is my screen showing?
Yes, we can hear you, and the screen is showing.
See the screen as
Thank you very much for the next few minutes, just to provide some facts about sugar sweetened beverages. And this would be my presentation outline to just draw on the burden of malnutrition and then zooming into what SSBs are and their composition and why we are concerned regarding the facts that we know about SSBs. So starting with this interesting slide, on the left, we know that malnutrition, especially undernutrition among children, remains a problem in Ghana. Stunting, wasting, underweight. They have seen some reduction over the years, and but they still remain significant. At the same time, overweight is also trying to pick up among children under 5 years old. And these are data from the Ghana Demographic and Health Service. If you look on the right, then you see also from the Ghana Demographic and Health Service, overweight and obesity prevalence among adults. And we see that it has risen all the way to 2014. 2016, I show a systematic review of studies that were conducted in Ghana, and then that gave something that was slightly higher. And in 2018, among adults in Ashanti region, through the Rofi study, we also saw something that was higher. So you can see a very nice increase, unfortunately, of overweight and obesity prevalence among adults. We also know that anemia among women of reproductive age remains a significant problem. So if you look at overweight among adults, anemia among women of reproductive age, and nutrition among children, we can see that Ghana is experiencing what everybody says, the double burden of malnutrition, where you have both undernutrition and then overweight and obesity being significantly a problem. I showed this slide also about the understanding what the risk factors for diseases are and what people can do about things. So we know that definitely there are biological and behavioral factors. These are downstream factors that people can take control of and then change in order to improve their health status. But there are also upstream factors like societal and structural factors, which people usually have no control over, which is sometimes...
so sorry to hold on to you. Sorry, a few minutes. We can't, your screen is not moving. And so I'm not sure whether that is from our side or from your side. And so, yeah, the control, yeah, okay, good.
Is it moving now?
You are still on the very first slide, as far as I can see.
Wow.
Is it in presentation mode?
It's on presentation mode.
Yes, now it has moved to the figure.
Okay, so maybe I'll keep it on this mode so that it's easier.
Okay.
So I was talking about the downstream and upstream factors, and I was just saying that the societal and structural factors, including food environments, usually these factors are not things that people have control over, and they may be the reasons why diseases increase in the population, even though we always want people to change their behavior and do stuff about them. And so when you look at this, what I've just shown with regards to the drivers of obesity and overweight in Ghana, we hear about the nutrition transition, whereby things around urbanization, modernization, changes in food systems drive the consumption of energy-dense foods that are low in fiber, that are micronutrient poor, coupled with low physical activity, people have increased risk for obesity, overweight, and then the prevailing NCDs that follow. And when you look at the picture on the right, we all can see that many years ago, when people did much more walking and went to farm to get the food and eat food that was directly from the farm, it's not the same now where people, for short distances will sit in trotro or find commercial vehicle or drive, and would also consume foods that are high in energy, including SSBs. And so we know that there is nutrition transition and it's driving the obesity that we see in the population. And so globally, the food environment is said to be obesogenic. And if you look at the Ghana picture, it's the same. What is an obesogenic food environment? It simply means the environment make access to foods that promote obesity very high. And so if you look at the pictures of the woman, especially the one that is stretching to be weighed, this is one of the studies that we did, and you can see people who are very morbidly obese. And if you look down, we know currently that you can compare cost of water with cost of soda or carbonated drinks, and sometimes even water is more expensive than soda. So we can say that the food environment is obesogenic because access to foods that promote obesity and lifestyle that promote obesity is very readily available. And I'm just showing you this figure again to say that it's not only in rural urban areas where we find overweight and obesity, but even in rural areas. So over here in Shanti region, through the Rofi study, we showed that 50% of the rural folks were overweight or obese compared to 59.1% of the urban folks. And that is not really different if you look at it in a certain way. But if you look at between gender, male and female, we see a clear difference where overweight and obesity is much higher in among the between male and female. So what we can say clearly is that the obesogenic food environment is not only limited to urban areas, but also to rural areas. And that is why there's a need to really take the necessary action. So this now takes me to the SSBs. What are they? So simply put, sugar sweetened beverages are sugary drinks, and that's the facts. And names have been changed, SSBs, to give them certain connotation of something that is very special, but basically they are sugary drinks. They are non-alcoholic beverages with added sugar. And usually the added sugar can be any kind of sugar or caloric containing sweetener. And usually they are energy dense, they have no fiber at all, if they have if very little, and they are of poor micronutrients status. There are different kinds of them. We have the sodas or carbonated drinks. We have sports drinks, which usually come in as if it's good for sports, but they are also sugary because they are sugar sweetened. Then we have the energy drinks that are also sugar sweetened or sugary. We have juices. So usually juices can be, paper packed or bottle packed, but essentially they are sugary drinks as well because of the amount of sugar and the fact that they are there's added sugar. We have even those that people refer them as vitamin drinks. So it gives a connotation that children should drink them in order to boost their vitamin status. But there's a high level of sugar in them, and they are sugar sweetened beverages or sugary drinks. We even have iced tea and coffees that are also considered sugary drinks or are considered as SSBs. Then we have the milkshakes and we have the dilutable powders. They are made as powders, but they basically you add water to them and then you drink them, and then basically they are also sugary drinks. And so I just want us to understand that when we are referring to these SSBs, we shouldn't only think about carbonated drinks, but there are very many different ones that now we see in the market all around, including the energy drinks are also SSBs. And even the ones that are made from the local alternatives, like Sobolo or precursor drink and all that. Some of them are also SSBs because of the added sugars and even the very high amounts of sugars that are in them. Why should we be concerned about SSBs? The NOVA classification of foods by level of processing was done some years ago, and then it showed that foods the level can go all the way to being ultra processed, and then they classified SSBs or sugary drinks as processed foods. And so if you look at the level of processing, starting from the kinds of chips that are packed, that are made from potato and all that, they are not very common here, but if you come down, the third level of processing by the NOVA classification in terms of risk are the SSBs. And if you take it that maybe the first two are not that common in Ghana, then we can even say that for Ghana, SSBs probably are the most important ultra-processed foods that we should be concerned about, that we should want to do something about them. And so let's take note. And of course, there are other processed foods that may also pose risk, but you can see that SSBs are one of the top ones that are available in Ghana. And it is of concern because studies have shown that they are associated with health harms. And so it is an increasing body of knowledge from Latin America, studies that were done some years there, and in France in particular, indicating that consumption of ultra-processed foods is associated with health harms beyond the critical nutrients that these foods have, such as saturated fats and other components that they may have, like salt. They are also associated with health harms. And the kinds of sugars that are added to these sugar sweetened beverages vary. So sometimes you don't see written as sugar, but there are many things that once you see written, they indicate that sugar is high. There's a high level of sugar in the drink. So all these names that you see there means that basically it's sugar. So corn syrup or corn syrup solid, or written as dextrose or fructose or galactose, basically means sugar. Even malt syrups and malt drinks, basically, we know that malt is from maltose, and maltose is basically glucose and glucose. So they may appear in a whole array of different kinds of ingredients mentioned, but basically they are sugars. And so the fact is that when we also talk to people, or when we even pushing for restrictions, we should remember that it may not only appear as sugar, but for as long as any of these components, ingredients are in the product, they basically are referred to as sugars that are in the product, or sugary drinks that we should be concerned about. And the mere fact is that SSBs are high in sugar. We know that one pack of sugar, so like a cube of sugar, is 4 grams. And 1 teaspoon of sugar is also 5 grams. It is known that a typical 12 ounce or 354 ml, so if you take one of our bottled sodas that we know about already, or a canned drink, which is about 330 ml, that's slightly lower than the 12 ounce, contains about 39 grams of sugar, or more than 9 teaspoons of sugar. So that tells us the level of sugars in SSBs, or a small can of SSB. And this 39 grams is equivalent to 156 kilocalories of energy. Some even contain more, as much as 46 grams, or about 11 teaspoons of sugars. Why should this matter to us? Because the recommendations for sugar intake is far much lower than what these SSBs contain. And the example I mentioned is just 1 can. So imagine if somebody goes for 2 or 3 cans. So that is exponential increase. But now let's take even just the 1 can. The daily sugar intake recommendations for children under 2 years of age, they should have no added sugar apart from the foods that they eat that have some sugars in them. For children 2 to 18 years of age, they should have less than 24 grams of sugar as added sugar, which is as part of their energy intake, and that only amounts to 6 teaspoons of sugar intake a day. For adult women, 24 grams, and that is 66 teaspoons. And for adult men, 36 grams of sugar is recommended per day, which is 9 teaspoons. Now, if you look at the examples of the drinks that I mentioned, you will see that just one small can of a soda or a juice or one of these sugar sweetened beverages is providing 1.5 times the recommendations for sugar for an adult woman. And so that's, and if the person goes for 2, 3, or 4 in the course of the day, then the person is getting much more than the recommendations. And I gave you another picture of the different drinks and the SSBs that are in town and what they contain. You can see the cola drinks have as much as 15 cubes of sugar, representing almost 13 or so teaspoons. And then going down to the sports drinks, the energy drinks, the other lemonades, and even the beverages that are dairy products and all that, having so much levels of sugar is far above the recommendations. One can or one bottle is far above the recommendations for sugar intake, and that is what makes it worrying. The facts also show that if you drink just one 600 ml SSB every day for a year, you will be drinking 23 kilos of sugar in a year. And the picture was supposed to be there. I don't know why it's not, but 23 kilos basically is referring to one full bag. The 50 kilo, if you remember, 50 kilo of cement, half of that, or 50 kilo of rice, half of that, or just sugar that the person is consuming. So SSBs really promote free sugar consumption, and which is far above what is recommended for people. The facts also show that approximately 11% of calories youth consume come from SSBs. And to burn off just 300, the energy or calories from the can of the SSB that I talked about earlier, a child must bicycle vigorously for about 30 minutes. And an adult needs 25 minutes moderate pace of walking to just burn that small can. What that means is that the more the person consumes, the less likely it is for them to burn that calorie, that empty calorie, and therefore the higher the risk of them becoming overweight. So it is not surprising that SSB consumption promotes weight gain. And the fact shows that consuming one can of soft drink per day could lead to 6.75 kilograms of weight in a year. 6.75 kilograms of weight in a year means that for somebody who does that yearly, in the next 10 years, the person can easily double their weight. In the 5 years to come, the person can almost one half their weight. And so that is a very important fact that people must be aware about. Each 350 ml SSB per day increases the odds of obesity by 60% in children. And among children under 5 years, carbonated soft drinks increases dental caries risk by 80 to 100%. And more research, and I mean, when you look at the data, research is showing from every source that additional serving of SSB increases BMI and increases the frequency of obesity and increases other factors that are associated with obesity. And the reason why we are interested, and sorry because the pillars have vanished one way or the other, and we are interested because SSB is not only a risk factor for obesity, but because obesity is the leading risk factor for type 2 diabetes, cardiovascular diseases, and some cancers. And that is shown in many studies. And just before getting to the end, I want to just talk about a study that I picked out to bring the facts that are in the studies. And I picked it out because of the largeness of the study that was conducted among about 42,000 primarily Caucasian men between the ages of 40 and 75. And they measured different serum lipids and proteins that were indicative of heart disease and controlled for other factors that are likely to affect heart disease risk, like smoking, physical inactivity, alcohol use, family history of heart diseases, and all that. And they showed that men who drank just 1 can of SSB a day had a 20% higher risk of heart disease. And by the sheer size of this study, we can clearly say that SSBs cause heart diseases. And if you look at the way we look at it, SSBs promote sugar intake, and sugar intake promotes weight gain and obesity is a risk factor for heart diseases, and that is clearly shown. Just a few more slides to end. I mentioned this already. Apart from the heart diseases, obesity, we also know that drinking soft drinks increases risk of tooth decay. And amongst children studied, they showed that the highest intake of SSBs were 2 or almost 5 times more likely to have severe early childhood caries compared to children who consumed the least amount of SSBs. And they also showed that these children also were more likely to have tooth losses because of SSB consumption compared to the ones who did not consume them. And in Ghana, from our ROFI study, we know that the SSB food environment is driven by not just big supermarkets, small shops play central role, even though formal retail like these mini-sized supermarkets in blue kiosks are also there, and they drive sugary drinks, confectionery, and sugar and all that. Even stalls, open markets, tabletops, and mobile food vendors all are drivers of the SSB food environment. And this is why SSB is accessible both in rural and urban areas alike. And so you can find in a rural area somebody having a tabletop and then selling sugar sweetened things, sugar sweetened beverages. And so it is not only like the big markets or the big food industry driving the SSB food environment, but almost everybody equally in rural and urban areas. And we also showed that everybody consumes them, the youth, the women, the older people, and those that drive the value chain are not nutrition conscious, so they really don't know whether the SSB have any benefit, negative health impact or not. But we also know that there's infiltration in the Ghanaian market and it's everywhere. And many would choose SSBs over healthy snacks like fresh fruits and vegetables. So I think I want to bring the talk to an end by saying that there is the opportunity for us to promote the healthy alternatives by policies that will create subsidies on them, policies that will make the production of them less expensive, policies that will prevent post-harvest losses of fruits and vegetables, including road infrastructure, storage facilities. But there's also opportunity for us to regulate the SSB's availability and access. And regulation means that restrictions are in place, enforcement of laws that restrict their access are also in place. And that is why taxations and levies are one of the factors that we have to think about. So in conclusion, just want to say that everybody says it Ghana's double burden of malnutrition. It is clear for all to see. And the SSVs that we are talking about, they are basically sugar. They increase caloric intake, they promote weight gain and obesity, and they are linked to heart diseases and diabetes and other NCDs and many other diseases like the two decades that I mentioned. And SSBs drive Ghana's obesogenic food environment more than these other obesogenic foods. And opportunities to curtail their impact, the health impact exist, and opportunities to promote also healthier alternatives exist. And I believe that that is the direction that we should be going in towards. So on that note, just want to thank you very much for the invitation and the honor to present. And sorry for some of the pictures that were missing. I transferred from one laptop to the other. Probably I got not the latest presentation. So thank you.
Thank you very much, Prof, for your presentation. Thank you very much. It's very clear to us. We will take the third presentation. That's what will follow from this. That is readily available healthier alternatives for us, so that we, instead of consuming these SSBs, what should we be consuming? We'll have Mr. Wise Lecha do the presentation. Mrs. Okwabi will kindly do the short introduction of Mr. Lecha, and then he will start the presentation for us. Mrs. Okwabi, over to you.
I hope you can hear me.
Yes.
Am I unmuted?
Yes, we can hear you.
Kindly go on. We can hear you.
Anthony, we can hear you.
James, can you?
All right, so let me quickly go through that. So,
Your first dietary advice. Can you hear me?
Yes, please go ahead. Yeah.
He offers dietary advice through weekly publication of articles in the Mirror newspaper, television and radio discussions, and news features. He also gives talks to groups, churches, and corporate organizations. He has undergone training, dietetics, nutrition, leadership, and innovation, which he undertook through the African Nutrition Leadership Program in South Africa, and also a Management Development Institute at the Lagos Business School in Nigeria. He's currently head of dietetics of the Trust Hospital and Clinic. He's a founder of Let's Consult Limited, specialist in medical nutrition and providers of dietetic services, and also organizes nutrition, wellness, and healthy eating programs for companies. Mr. Wise Lecha is the author of the following book: Be Your Own Dietitian, Volume 1. Eating to Prevent and Manage Lifestyle Diseases. And the third one, Live Long by Eating Well, Volume 1. His books are available on the Google Play Store. And with this rich background, I think it's whetted the appetite for us to look forward to other or healthy substances that we can use to replace, or healthier substances that can be used to replace sugar sweetened beverages. So, Mr. Lecha, we are all ears for you. Thanks for accepting to join us.
Thank you for the wonderful introduction. I'm happy to be here. But before I go on, I just want to be sure that whilst I move my slides, it's moving at your end as well. I just want to move to the second slide, the third one, then you give me some feedback. Thank you.
Yes, it's moving. Thank
All
you.
right. Yeah, thank you. Thank you. I would say Auntie Bohemina for the invitation, and I want to thank the Ghana Public Health Association for considering me to be part of this powerful team to throw more light on the issues. Sugar sweetened beverages are not doing us any good. And whilst I say hi to Professor Annan, Reggie, you are such an inspiration, and I salute you. Thank you for setting the tone, and I want to look at the way forward. We have seen that the sugar sweetened beverages are not good. So what should people be drinking? So the question is there the need for alternatives? Yes, there's the need for us to look for alternatives. And as nutrition practitioners, when we are sitting in the clinic and we have to offer proper alternatives to all the bad things that we tell people not to eat. There are some situations that you cannot prevent, like children. Children have to take snacks. So what should they take? We know that the sugar sweetened beverages provide too many calories. They end up developing a lot of fat cells, and it's not good for their health. Childhood obesity is on the increase, and childhood onset of adult diseases, diabetes and all that is on the increase because of all these kind of snacks that children are taking. So what should they take or drink? I believe this campaign we can win if we are ready and are able to give alternatives. And that's exactly what I'm coming to do. I have just a few slides so that I don't bore you with too much of the talk. So the first alternative is in the class of blended fruits and vegetables. Smoothies has become part of our societies, and every person who wants to eat healthy feels that they should drink some smoothie of a sort. And there are so many types, so many recipes that we can follow on. But I want to emphasize that fruits or vegetable smoothies can be very good alternatives to sugar sweetened beverages, and they are readily available. But then the fact that they are fruits doesn't mean they are so free of sugar, so we can just take so much. If you do a lot of the blended fruits, you are just like someone who is drinking any of the sugar sweetened beverages that we know of. So there's a need to promote the need for people to be aware of the portions or the quantities or the volumes of these blended fruits. So if we take blended fruits in isolation, there really is the need for us to always prescribe the kind of portions. It's not good for somebody to just take a whole bottle of blended fruits, let's say 500 mils, and take probably from 2/3 to half of that, 200 to 250 mils of that could be okay. And if you also mix fruits and vegetables, then the load of the fruit should go down so that the vegetables will take a bigger part of the bulk, and that is even better. So if you have a fruit vegetable blend, for example, and mostly you use vegetables, different types, the types that you like could be kale, etc., and then you throw in an apple. At the end of the day, you'll be adding just about 10 grams of sugar to that mixture, and that should be allowed because that's just about 2 cubes of sugar. So in moderation, that is fine, but if we let loose, people can end up getting problems from issues or problems that the usual SSBs will end up giving. So blended fruits in moderation, more emphasis on blended vegetables, a blend of fruits and vegetables, but then fruits in smaller portions and the vegetables in larger portions could be something to follow. And then Herbs. So the second alternative I want to talk about is herb and spices mixtures. Herb and spices mixtures. People are so innovative these days. So they're able to put together herbs like or spices, ginger, garlic, and stuff like that, cloves and cinnamon, mint, and co. They brew this as though they are brewing tea, and it comes out well as very good drinks. But then the shortcoming is that sometimes they add sugar to give it a sweet taste. And so in this context, we would want to caution that people can prepare these infusions or herbs, but then they should drink them sugar-free or go very low on the amount of sugar that they are adding. Sobolo can be a very good alternative, but it should be sugar-free, or you control the amount of sugar that you add. And also some people use fruits. So if you have just a little serving of fruits to sweeten your sobolo, at the end of the day, the sugar load will be lower compared to most of the SSBs that we know of. So if we work around it well, we can really use sobolo. And sobolo that is even spiced with cloves, etc. A lot of our diabetic patients have sobolo, just some spices and not even fruit in them. And they are good drinks, gives them the feel of taking a drink. It may not be sweet, but then we know that the tongue can perceive all sorts of tastes. So it depends on which area you are training. People can actually be able to even get used to some of these drinks. And a lot of the time, our diabetic patients are just able to switch over to sugar-free tastes, and they can drink their porridges and co. Even when their management gets to a point where they can make do with some sugar, they are not even ready to add it. So it's possible for everybody to be able to work around this hibiscus sobolo drink, and then it can be a very, very excellent replacement alternative to the SSBs. Cocoa beverages. We are a country that boasts of producing so much cocoa. I think the second largest producers also in the world, but we are just interested in selling the cocoa beans to other people. And then they bring us the finished products loaded with sugar that make our populace unhealthy. I think we can also go on a campaign to promote locally produced cocoa beverages. Of course, watching the amount of sugar in them, and that can be very good. We are from Ghana, we don't know how to drink cocoa beverages. And the ones that we see around have so much sugar in them. We can even appeal to some of these companies to produce the beverages, sugar-free types. I'm looking forward to a day where we'll have Milo, sugar-free Milo, and that will help a lot. And then there are these cocoa beverages, very natural cocoa powders, the ones that people believe that when they drink, their hypertension will go, etc. They are sugar-free, they are very good drinks, but then I don't want anyone to go with the mind that the drinks will cure their hypertension anyway. But then they can be very good beverages, options at parties, and people can have some drinks, even though they remain healthy. Teas can also be a very good alternative to SSBs, but we know that tea goes with sugar. So the caution is let's prepare teas with just a cube or two of sugar, and that will be it. Our own lemongrass that I don't think many of the young people, even on the call today, have taken before. But then these are very natural gifts that God has given our land, and we can always have them. We can prepare them and serve them at our programs, at parties, even use them chilled in the house without sugar, and there should be no health risks associated with them. So there's the option also of falling on diet soft drinks, but then you all know the many issues or controversies that exist surrounding sugar substitutes, sugar alternatives, which are used to sweeten some of these diet drinks. So But then in the end, you want to see how many calories these drinks will add to the diet in a day. And if there's a sugar substitute, which is 0 calorie, then it fits the picture. It fits this purpose of being a very good alternative to the sugar sweetened beverages. So diet soft drinks, yes, but then should not be something that we switch over to. Many people say they don't drink soft drinks, but they go for alcohol. As you can see, sweetened alcohols are also SSBs, and alcohol in itself poses a lot of health risks or challenges. So people should not even be going for alcoholic beverages. And then water. If I had my way, I would have just presented water as the best or the only alternative to sugar sweetened beverages. But then I'm not the president of the world, so I cannot do that. But then water is one thing that we can always go to. Sometimes when you feel thirsty, you may sense it as hunger. So especially between meals, the period where people fall on these SSBs, when they feel for lighter foods, then they go for the can and all that. If they can just take a little bottle, a small bottle of water, or just a glass of water, I'm sure they'll feel all right and wait for their next meal. So we have to also promote water intake. Water regulates body temperature. The benefit of water helps aids in digestion. All metabolic processes require a water medium to thrive and all that. So, and water has no calories. So it's the best alternative. Some people want to flavor their water so that they can be able to drink enough. Yes, it can be allowed. We can promote flavoring of water, but to what extent? If we use lemon in water, just a drop, yes, that is fine. But then we shouldn't end up flavoring water with any products that will end up adding too many calories to water intake should be encouraged, not like telling people to take 8 glasses of water a day, but then people should actually live on water throughout the day. So from morning to early evening, you keep sipping water. So anytime we feel thirsty, we've lost about 1% of the water in us. So there's the need for us to keep hydrating, which can even help control our appetites, control our food intake. If you drink water before you go for a meal, physically water has filled the tummy. So not so much food can go in and you have the desired levels of satiety. So water is good. Just that when people drink water in the night, they may have too many wake up times to urinate. So we advise you taper or downwards, go a little lower on the amount of water you drink whilst the night falls. So I'll end it there on say a big thank you, but then that's not all. We can all think of various ways or some of the things that people can even, I'll be very happy if we even put in the chat box the various ways that we are able to put spices and herbs and fruits and vegetables together to produce some drinks that are not the traditional SSBs that we know. And I believe that we all can be very innovative and even come out with so many of these products. Thank you very much. And as was said in the introduction, I authored these books. They're available on Google Play. I don't talk anywhere without talking about my books. So let me do that before I hang the mic. They are also available in bookshops for 30 cedis and then downloadable for just 5 Ghana cedis. Kingdom Books is our main distributor, but then you can pick our contacts there, you can pick my blog, can also make requests for these books, and we deliver to people everywhere in the world. Thank you very much. Over to the moderator.
Thank you very much, Mr. Lecha, for your presentation. So for now, we've spoken about the facts about SSBs, and we've spoken also about some of the alternatives that we have, which when we're able to use can save us from the consequence of these SSBs. As we mentioned earlier, one of the purpose of this project is to advocate for a tax component on these products in order to reduce consumption. So we'll take Professor La as he speaks to us on health taxes as a tool for NCDs prevention. And so, Prof. La, you have the floor. Before you speak, Madam Mina will kindly introduce Prof. La to us, and then we'll listen to Professor La. Let me also add that he is a project lead for the project we are working on currently, and so he's the best person to speak to us on this particular topic. So, Auntie Mina, please have the floor. Thank you.
Thank you very much, James. Well, Prof. La is a tenure-track academic at the University of Ghana School of Public Health. He has received academic training in nutrition, public health, and bioethics. He spent the decade spanning 2003 to 2013 exploring the social, cultural, socio-ethical, and medical ethical dimensions of HIV. This body of knowledge is summarized in a book that he recently published titled Social Public Health. Currently, his research and professional practice focus on two distinct yet related areas of public health. Bioethics, where he's interested in food ethics, ethics and public health, and health and human rights, and public health nutrition, where his work focuses on food systems, food environment, and nutrition-related non-communicable diseases. Overall, his work contributes to a deeper understanding of how physical environments, social environments, and structural factors affect health. Prof. La is the principal investigator.
I'm unable to hear Antimina. I guess she's done with the introduction. Moderator, can I? Or
Am I back?
oh, okay.
Yes, you're
Hello?
back.
My line keeps breaking.
Yeah, we can hear you now. Go on.
All right, so then I'll continue from where she ended so that we can move on. So Prof. La is the principal investigator of the IDRC-funded News for NCDs project, which is providing measurement, evaluation, accountability, and leadership support for NCDs prevention in Ghana. He is also the PI of the IDRC Rockefeller Foundation-funded Healthier Diets for Healthy Lives project, which we call the HD4HL, which aims to develop, validate, and build consensus for a fit for local purpose nutrient profiling model that allows for implementation of several food-based policies. And as I mentioned earlier, he's a principal investigator for this project, that's Advocating for Health project, which aims to create a favorable environment and stakeholders buy-in for food-related fiscal
The
policy.
Rockefeller-funded Healthier Diet for Healthy Life project,
The partners
which aims
of
at
this project,
development, validate, and building consensus for a fit for local purpose nutrient profiling model that allows for implementation of several food-based policies. Of note, as has earlier been said, he is a principal investigator of the Advocating for Health project, which aims to create a favorable environment and stakeholder buy-in for food-related fiscal policies in Ghana. The partners of this very project include the Ghana Public Health Association. Professor La is a fellow of the Ghana Academy of Arts and Sciences. And James, you said rightly so, that we are very lucky to have him to be with us this evening. And I hope we'll continue enjoying the evening with him. Thank you very much.
Thank you very much, Antimina and James, for that generous introduction. Good evening to you all. I would like to, from the onset, express my gratitude to the Ghana Public Health Association for their collaboration, but also leadership in this very event. It's really been a pleasure working with public health associations like the Ghana Public Health Association, civil society organizations, Ghana NCD Alliance, Ghana Academy of Nutrition and Dietetics, on this project that we codenamed A4H, Advocating for Health. We are advocating for our health. We are advocating for your health. We are advocating for Ghana's health. This evening, I've been asked to say a few words about some of the interventions that can be deployed to combat NCDs. And so health taxes is what I'm going to talk about. I would provide rationale or justifications for such an intervention, talk a bit about their pros and cons, and then summarize some of the research and advocacy work that is behind this evening's engagement. With your permission, I would start with a quotation from Benjamin Franklin, an American statesman, who said, and I quote, that nothing in this world is certain but death and taxes. And I think all of us here can attest to that fact. When we make money, we get taxed. When we spend, we get taxed. When we save, we get taxed. Even sometimes, depending on the jurisdiction, when we die, we get taxed. So, and tax is not something that a lot of people love, but they are, as it say, necessary evil. We would like our government to provide us with the resources that we need as citizens. And one of the resources that they have to be able to provide us those resources are taxes. And so the schools that we need, taxes contribute to social amenities, security, infrastructure, taxes contribute to. So taxes are important. The specific kind of taxes I'm going to be talking about this evening, and I usually don't talk about this, are called health taxes. These are special taxes, specific taxes levied on goods that are deemed to be harmful to individuals and to society. And so such goods as tobacco, alcohol, some of the non-alcoholic beverages, SSBs that we talked about, and those foods that are usually high in fats, sugars, salt, but also gambling. In some jurisdiction, even pornographic content, taxes are slapped on them. All those would qualify as health taxes. Initially or traditionally referred to as sin taxes, we do not wish to use that terminology these days because of, there are good reasons why. The initial idea was to generate revenue, just as all taxes do. Currently, over the past couple of years, there has been an increasing recognition of its core role, its core mandate, which is protecting health and promoting health. So that is what we refer to as health taxes. They have two main goals, as I noted: improve health of individuals, but also generate revenue. And usually, currently, revenue generation is seen as a positive externality, not the core goal of health taxes. There are indeed other reasons why such levies are imposed on those goods to correct for what is technically referred to as market failure. Most of us here, all of us understand, most of the time we go to shops, we go to stores, and we have price tags on goods. If you do a deeper analysis, the price tags that you have there are actually not true costs of those products. Taxes like these sometimes would take into consideration the implications or impact of those products beyond just the individual that is consuming it. So market failure corrections. Information failure as well. There are times when, industry or private sector would either deliberately or unwittingly not provide information that people would need to make informed decisions. And so if you have an intervention that circumvents that individual level decision making and makes that product not to be available, we are not going to be burdened with making such decisions, right? And so that's when questions of agency comes in. And in public health, we do have two major kinds of interventions: low agency interventions and high agency interventions. Interventions that are referred to as low agency are they include these health taxes. They do not require the individual to make use of personal and cognitive resources, like brain power to be able to read what is being presented to you, to be able to analyze and understand and make decisions. Already there's a tax that is imposed, and as a result of the tax, industry reformulates or the product is no longer very available. So we benefit. So health taxes have important public health benefit. And so I usually refer to as a win-win-win, especially when they are earmarked. They can have very specific uses, and it could be used to promote only health interventions, say providing or financing universal health coverage. Others have even argued that health taxes could contribute to achieving some of the sustainable development goals. So reducing NCD beds, goal 3, greatly benefiting vulnerable populations, goals 1, 5, and 10, but also boosting economic development through healthy workforce, goal 8. And that is why the World Health Organization over the past couple of years has endorsed health taxes as part of evidence-informed strategies for preventing not only just NCDs, but other conditions as well. And so excess taxes on tobacco products, alcoholic beverages, reducing sugar consumption through effective taxation, not technically referred to as a best buy, but it is an effective intervention. So the best buys, they have 3 categories. So there are some that are truly best buy because they are cost effective. Others are known as effective intervention. This is not too clear, but these are some of the best buys. And down here you can see elimination of industrially trans fats through development of legislation to ban their use is an effective intervention, and so is SSB taxation. So to summarize as to why health taxes, those reasons I have given relates to ensuring that we have populations that are healthier, we have individuals having healthier lives, but also countries having wealthier treasuries. We generate money. But I can't talk about health taxes and present only just the positives. There are important negative externalities. And sometimes some food environment actors come with oppositional argument to health taxes, some of which, or most of which arguments are usually are not facts. Questions relating to tax evasion, that if it is imposed, that people will find ways of evading it. Questions of substitution. So SSB is taxed, they are going to just stop consuming SSB and move to consuming other equally unhealthy products. Questions relating to regressivity. People argue that the very people that you are interested in protecting, the vulnerable, are those who are going to be affected most. Indeed, we do have evidence that speaks the contrary, and I'll present to you some of those evidence today. But one other thing I would want us to note, and it's truly important, is the fact that there are a number of things, depending on the way it is designed. If your SSB tax or health tax is not designed properly, you may not benefit from it. Take, for example, the sugar sweetened beverage taxation we are talking about. Using evidence, WHO recommended that the tax should be structured and implemented in such a way that it increases prices by 20%. And so if you introduce a tax and we call it pass-through rate, the effect on retail price is as low as 5%, 10%, you may not benefit from it. So that is critically important. And that's why sometimes some of the evaluations will say, oh, this country introduced a health tax or SSB tax, and there was no resultant effect on the final outcome, say obesity. All these need to be taken into consideration. One other thing, I think I talked about it earlier, had to do with once the money has been gotten from it, what do you use it? How do you use it? What do you use it for, and how do you use it? So questions of earmarking comes into play, and you can either do hard earmarking, where the money gotten from it is used for a specific thing. You can't even use for any other thing, or soft earmarking. There are government who have implemented this and the money is not earmarked. And you know, sometimes how money is being used by our government. And so the money would find itself elsewhere. So earmarking is known to be important. One other thing that those who present those oppositional arguments have always questioned is, do you really have evidence? Is there evidence that this really works? And so those who are interested or looking for evidence can visit a compendium of research findings and evaluations that is compiled by the World Cancer Research Foundation International. They looked at lessons on implementing robust sugar-sweetened beverage taxation. And I'm presenting to you some of the findings or evidence compiled by them. If you take Mexico, for example, their 10% tax on sugar-sweetened beverages resulted within a year in 6% reduction in sales. By the second year, it had gone to 10%. And their evidence showed that those who reduced purchases or consumption of these were those who are socioeconomically disadvantaged. So with this, you can argue that it's not necessarily regressive. In Chile, the tax was able to reduce monthly purchases of the high tax good, not only just sugar-sweetened beverage, but other unhealthy products. South Africa, the United Kingdom, Portugal, Malaysia, and others, even before implementation, industry were engaged and started acting on what is technically referred to as reformulation. And so before you are even taxed, they reformulate and reduce the amount of sugar in their product, either to the extent that you are not taxed at all, or the tax that you pay is minimal. Because no one is interested in punishing industry or preventing anyone from making profit. All we want them to do is to have positive or healthy profit. And so if you reduce the amount of sugar that is causing the problems and you still make your profit, yeah, thumbs up. We are all going to be happy. What you see here is the evidence from Mexico. You can see a significant reduction in SSB sales, as I noted earlier, 6% drop in 2014, 8% 2015, and 11% drop in the half of 2016. At the same time, there was an increase in consumption. I think White was talking about that, Mr. Lecture was talking about that. So increase in consumption of bottled water. What you see here is soda consumption and then obesity in selected countries. You can see there's a correlation, a direct correlation between amount of soda that is consumed and then national level obesity prevalence. This shows an inverse relationship between soft drink prices and then consumption. And so there's evidence that once price is increased after a certain proportion, then there's a resultant decrease in their consumption. And it is this evidence that WHO and others have used and are now promoting health taxes, which includes sugar-sweetened beverage taxes. If you're looking for additional evidence, they abound. I guess in 2022, June 2022, JAMA published this work that showed that in over 45 countries, SSB taxations are being implemented. They are here, they have taken off, and they will stay. While this is being implemented globally, some of the work that we have done noted that their implementation or adoption was patchy in the African continent. And there are quite a number of reasons why. I do not have enough time to talk about that, but the caution that I gave in this publication done last year was the fact that as we are promoting or advocating for public health interventions that have been successful in other jurisdictions or settings, we ought to appreciate where we are coming from. And so the peculiar heterogeneity of the Ghanaian or therefore African food environment and its variegated political economies ought to be taken into consideration. We are facing a syndemic of malnutrition, a syndemic of obesity, but also other diet-related non-communicable diseases. And as Mr. Lecha noted, if you are interested in enforcing policies that disincentivize consumption of unhealthy food, that is fine, but that's not enough. You ought to couple that with interventions that avail those healthy, nutrient-rich food. He was talking about water. Yes, tell people not to drink sugar-sweetened beverages, but make it possible for them to drink that water. Those who are interested in evidence relating to, the World Treasury, as I talked about, the tax, when it was implemented in South Africa, within just 1 year, raised 3.2 billion rand. That's in South Africa. In Hungary, when they introduced this, within 3 years, just directly linked to the tax, they raised 200 million euro. So the health benefits are clear, the economic benefits are also clear. So Ghana, what are we waiting for? That is why we are here. We are advocating to our government, we are advocating to our policymakers, we are advocating to all Ghanaians to support us and to have that favorable environment created for this tax to be implemented. I think I'm almost at the end. This is the last but one slide. And so that is why we are here. That is why Ghana Public Health Association and the other civil society organizations have joined us to implement this project in Ghana. I will stop here. I think, is my time up? I think I hear. Okay. Yes, so I will skip this and move to thank those who are behind this work, our funders, but also government agencies who are supporting this. Overall, we want to create and improve the food environment, the Ghanaian food environment, and we believe that some of these interventions, as you can see here, which includes fiscal policies, will contribute to improving the overall food environment, leading to improved health and nutrition outcomes, and then ultimately to having Ghanaians living healthier lives. The Rockefeller Foundation, IDRC, and then the Global Advocacy Incubator have contributed financial resources to the work that we are doing. So we thank you, but we also thank them for those resources. Let me yield now and give it over to the moderator. Thank you.
Thank you very much, Prof, for the presentation. Because of time, we'll go straight to our first presentation, and Dr. Akome, you can start the presentation for us. Thank you. Let's know that at the end, there will be question and answer session. Also, you can start writing your questions in the chat box and we'll attend to it. So, Dr. Akome, please, you can start. Thank you.
Well,
thank you very much. I think that most parts of the presentation have been expanded on by the various speakers, and I will just quickly rush through this presentation. So basically, we wanted to so the only additional things I would add are that so far, with the kind of research that we have, in addition to what Prof. La just talked about, we look at the Ghana-specific evidence as well on interacting with our policymakers, especially those that have direct interaction with the finance people. As we continue to make a case, it's important that we also look at using HTA to provide direct economic analysis of the implications of these taxes. So when we are looking at these sugar-sweetened beverages and the available alternatives on the market, if we can apply HTA to provide this evidence. Then when we are presenting this scientific information to either FDA or for NHI to cover an alternative, we do have the information readily available. The evidence from other countries are almost perfect, and I mean, we continue to rely on them. At the national level for us, there are a few structures that are used to also guide the process. The NCD Steering Committee, for instance, is available, and the NCD policy was launched in April this year. Beyond that, various guidelines have been developed with the aim of engaging our health workers and providing awareness, even amongst health workers, because one major challenge we have for NCDs is ignorance, even amongst health workers, ignorance amongst policymakers, and as issues surrounding the country are being addressed by these policymakers, it's important that we make them more and more aware about NCDs, and in this specific case, the implications of these sugar sweetened beverages for us as a country. We at the program rely highly on partnerships, because without our partners, there's very little that we can do. And it is these partnerships that help us to advocate for context-specific issues, and we will continue to ask that as partners engage in their activities, they continue to bring us on board with our national expertise as well, so that we can all contribute to the discussion. And in this regard, I'm most grateful to the Public Health Association for engaging us. I think I've talked about the research bit, and the few things that are ongoing in this regard are the multiple collaborative efforts that are available, and it is these continuous engagements that will help us to move forward. I didn't talk much about the prevalence and things, because I think a lot has been said at the beginning, and I'll be around to support in the discussion once any questions come up. I'll also be sharing the presentation for deeper context. So thank you very much, and let's continue with the discussions.
Thank you very much, Doc. And we will thank all our 4 presenters for speaking to us today. Dr. Mofa, kindly take over for the Q&A session.
Yes, thank you all, and good evening. We will take only 10 more minutes because we will run off before 9 o'clock. We don't want to move past that. And so just a few questions to any of the speakers, now, not necessarily to any particular person. And so if you have a contribution, if you a response, you make it snappy, and then we move on. The first interest is the inordinate, what some of us will call it, inordinate advertisement of these SSBs on our radios. I mean, promoting all those things and linking them with being mature, lively, active, and so. How do you think that we can confront that? I mean, as part of our multi-pronged approach. Anybody? We take two responses from any one of you, and then we will move on. Yes.
Maybe I will start on it. Okay.
Okay.
Sorry. So please, would you respond, or you're taking more?
No, go on, Prof.
Okay. I could start, and then my colleagues can contribute. I think it's an important question of observation. One of the approaches to address is what is technically referred to as policy bundling. And you see, there are multiple problems, multiple challenges if you fix SSBs using SSB tax and you do not fix the others, the problem would persist. And so I just wanted to give an example of that other initiative. I had to run through the slides, but it is interested in deploying what we refer to as double duty policy bundle. In that bundle, you have the health taxes, but you also have policies relating to labeling, front of pack labeling. You have policy relating to marketing restrictions, what you are talking about. And if we adhere and implement what WHO is suggesting or recommending that countries do, is to ensure that those policies or regulations are in place that restrict the marketing of especially unhealthy food, those that are targeting children. They target children for all kinds of reasons, and they know why they are doing that. And so I think I have to be snappy here, but I think things have to be coordinated. So policy coherence, policy bundling, so that we don't just do SSB tax, but you are doing SSB tax, but the same government is also regulating or restricting marketing of unhealthy food that are targeting children, and then labeling and other policies as well.
Thank you very much. Hadi, I can see your hand. Any quick comment or question? Hadi, you can unmute yourself.
Hello.
Yes.
Hello. Good evening to doctors and then senior professors and then all the lead presenters. Good evening, please.
Yeah, good evening. Go on.
Okay. I just have two quick questions. One is on the alternative of the SSBs. When you look around as per daily shops, provision shops, you go to see, walking around, moving by the roadside, by the street, wherever you find yourself, you find out that eventually we are still seeing the availability of these sodas, carbonated drinks, or the SSB form of drinks just available around us. So if there are reasonable alternatives like the fruit juice or the blends that can be put into beverages, is it possible, or what as a team are we doing to make those ones to equally available at our drinking shops, at our provision shops, so that people who want to make the right choices can easily access? Instead of most of these blenders, you have to get home by yourself, get the fruit, either watermelon, oranges, or what have you. Then you have to blend them yourself before you can get access. And time,
Okay.
in fact,
the second yes, question,
yes.
I think the first one is right.
Yes. Okay. So the second one quickly is with regards to the NORAD intervention by World Health Organization, the PEN program or project that is going on. What is the health system trying to do so that we'll be able to harness? Currently, there's what we call wellness clinic existing in most of our health facilities. The mandate is also screenings. And the World Health Organization intervention, the PEN project, have also come in support with this. It's supposed to be an integration. But believe you me, when you go to the downstream, you realize that the wellness clinic services and then the PEN or World Health Organization project intervention are addressed, or as the screening is going independently. What are the plans for us to be able to harness all of them together so that we'll have the bigger benefit of the project in the wellness clinic instead of them operating more?
Thank you very much. We will respond what the otherwise will later.
Yeah,
and the topic will also come up, but I want to pick a few more. It's becoming interesting. Maxwell, can you unmute yourself? After that will be Kreshi, and then I'll take some others. before we respond together.
All right. Thank you so much. Thank you to all the presenters. My question is to Prof. Lal. I know that from experience and from practice, the SSB taxation is the way to go. But in a very thick environment where, I mean, some governments may find it very difficult to introduce taxes because they are already existing ones. I know there are a lot of, multi-stakeholder engagement ongoing, but I wanted to know from the Mexico point of view, how were they able to do it? In case we are met with resistance or on the part of government, how do we get this thing through to be able to get it to what Mexico was able to do to reap the benefits?
Thank you. And then we will take quick responses from the presenters.
Thank you, Dr. Amofa. I want to commend all the presenters for the excellent presentation. My comment has to do with the way that the SSBs we know are causing health problems. I think also that one of the areas we can focus on, particularly with regards to the increasing child overweight and obesity, is to look at how to engage stakeholders such as the schools, the teachers, the PTA, and to see how best we can encourage them to help the students in the kind of food that they bring to school, the snacks that they bring to school, for example. Because if we are looking at reducing the health risks among them, in addition to the tax component that we are talking about, we should also engage in some education, particularly in the school. For example, if my children go to school and they are not given sweetened juices and we give them fruit, the teachers commend them, in the presence of the class. And I think actions like that can motivate others to also join. In that way, the consumption can reduce and the health would be improved. Thank you.
Shall we take responses from Dr. Wise and then Dr. Komi? Dr. Wise is more on the other alternatives for SSB in terms of its promotion on the market.
Yeah, thank you, Dr. Amofa. I think I would want to pick it from what James Paul just said. There's a need for education. We need more fora like this. We need professionals to speak. Matters of nutrition in our country have been left in the hands of those who are not professionals for too long. And our professionals have so much knowledge, but then we don't educate the public. So wherever we are, we try to brighten the corner where we are. When we leave this conversation, let's take action. Let's talk to the groups we have the opportunity to speak with. Let's talk to our churches. Let's talk to our children, school, anywhere that we have a bit of opportunity and influence on our social media platforms and all that. Let's just push the education down there. But then nowadays, I see people packaging some of these local alternatives. Some actually even go ahead to go to the Food and Drugs Authority for registration. Then they are supposed to do nutritional analysis and all that, and then produce labels and put on this product. So entrepreneurs are also taking it up. We can sell the idea to many more. And those of us here who also have some money to invest, let's also go into producing some of these healthy alternatives. And I believe by the time this campaign takes off or ends or reaps its benefits, we should also be in the position to roll out another campaign to actually encourage people to go into making these alternatives available. Thank you. I'll end it there.
Yes, Dr. Komi, link it with the wellness clinics, and
yes,
somebody wanted to find out more about the actual prevalence of diabetes in children. I've seen you giving a few in adults,
Yes,
but just in case. Yeah.
Thank you very much, Dr. Mof, and also for the question. In terms of the wellness clinic and screening services, quite a number of things are going on in the background, but basically, the wellness concept is also relatively new for us. But beyond that, screening guidelines have, and there's a first draft that has just been developed. And the guidelines, at least, is to help streamline screening activities amongst health workers, especially for NCD services. The other angle is that there's a huge challenge with bringing on board CSOs and organizations at the community level who also undertake these sporadic screening activities that go unrecorded. And in that regard, we've been working also with PATH in terms of using a platform called the NCD Navigator and lobbying partners at the community level to come on the Navigator site that they can record their activities, including screening services. Now, once these activities are recorded, the regional health directorate and the district health directorate are also on board, and they can get in touch with them so that these, should I say, scattered activities can better be coordinated at the community level. And their data also uploaded into our system, because most of that information is lost on us. The wellness concept itself has its own challenges, but for most places that it's being implemented, I know they are screening for hypertension. Screening for diabetes has become an issue because of the cost of the strips. And as a result of that, in quite a number of places, the screening for diabetes is not done. I know they are also developing certain guideline documents. And then beyond that, we are also undertaking the concept of the networks of practice, where their district hospitals will be given capacity to supervise work that is done within the various communities. And then beyond that, too, somebody mentioned working with schools. It's an absolutely brilliant idea. If we're able to incorporate these preventive messages into children, they tend to translate them into messages in the various homes. Mommy, you are not supposed to do this. No, I will not drink that. In that regard, then we are collaborating also with SHIP, the school health education program, to draft simplified messages that we can test out in the primary school, so that they can incorporate it into their action plans, and the teachers will keep mentioning the message to the children for us to see whether it will translate into any palpable results at all. So those are the few inputs I wanted to make with respect to the questions. Thank you.
Thank you very much. Dr. Mofa. Yes,
Dr. Agana first, and then it will be followed by somebody called Alpha, and then Tamimu. Make it snappy, all of you, and then after, and then Prekon will, and then we will get some responses and round off.
Thank you, Mr. Chairman and everybody. I hope you can hear me. Can you hear me?
Yes.
Yes, sir.
Yes. Yeah, we can.
Thank you. I want to suggest that while we battle this from the nutritional point of view, if we link it up with the fact that these SSBs are put into plastic containers, which are becoming a terrible environmental nuisance. So if we marry the two issues, maybe we can get a faster, more amplified response from the public against them. But actually, my real question goes to Mr. Lecha. Now, you know that fruits, they are also sugars, but they have various stages of should I say, maturity or something. I don't know whether your books and your studies go into stages of use of the fruits such that the sugar content consumed is not as high as we want to avoid. This is to Mr. Lecha. Thank you very much.
Alpha, I don't know the name behind it, but I can also see Alpha.
Oh, okay. Thank you very much, and I really appreciate everyone. I hope you can hear me, sir.
Yes, you can.
Okay, mine is not a question. And first of all, I appreciate all the presenters and everyone who is on board. Mine is not a question. Mine is a suggestion. I think the government has implemented this Green Ghana project. So if it were possible, why don't we also push for planting of fruit trees? That's fruit tree seedlings. And this one would help us get the fruit trees, the fruits when they're in season. And this will make it available for each and every one to do. Currently in the Volta region, we are doing something like that. And I believe in OT2, some schools have started planting fruit trees. So when you do that and we link it with the schools, it would inculcate the habit of planting fruit trees in children. And when they go home, they would go and replicate the same thing. And as my seniors have said, the students will become our ambassadors, or they become the pastors in the various homes. So I want to put it before the house that in the next year, the Green Ghana project, let's lobby for more fruit trees to be given to the schools to plant. Thank you.
Thank you very much, Tamim, Yakubu, and then Prepon will end it.
Good evening. Hello, can you hear me? Good evening.
Yes, we can.
Yeah, my question is, before I ask my question, I just want to thank the presenters. The presentation has been so, revealing to some of us. I've really learned a lot from the presenters. Thank you very much. My question is to Lecha. With your presentation, when you were talking about the alternatives, to the SSBs, I remember you said sweetness could be an alternative to sugar. I don't know whether that is quite appropriate, because when you look deeper into some of the sweetness and the fact that some of them can lead to, cancers, I don't know whether that would be an appropriate thing to do.
Can you plug this somewhere? It's almost going up. Okay, there will be a response, and then we will see what.
Good evening, and thanks. Thanks for the opportunity, and thanks to the presenters also for well exposed information. I guess my question probably would go to Madam Ifwa on the aspects of the sites that she mentioned that community screenings can be hooked up on for kind of a dashboard kind of experience, or for us to know what is happening within community on non-communicable diseases. I think there is one very core group of people that are doing a lot in terms of community screening, and that is the churches. I don't know how far such a program is actually getting in touch with some of these churches, because there's a lot of, at least I know more about the Orthodox churches that a lot of them have formed this health professional groups that goes from community to community and actually providing screening service. Most of the times, these NCDs are captured within it, within their screening processes, including the aspect of diabetes as well. So how are they linking up with these churches to actually promote some of the activities?
Thank you very much. And I will actually invite Prof. Anand just to make any 1 minute or 30 seconds response to anything that has been asked, if there's any yes, opportunity to respond. Yes, any of them, and then Wise will follow, and then Dr. Komi will end.
Yeah, well, just a quick response to one of the comments regarding, where to start from and how to do many other things to promote a healthier food environment and then to reduce the consumption of SSBs. And then one gentleman also mentioned what the process the Mexicans use to come to where they are. And I just wanted to say that, there are so many things that can be done, but we have to start from somewhere. And so we are starting from this place where we are now, where we want to, move towards advocate for the taxation of the SSBs. And that alone goes through many processes, including a lot of stakeholder engagement to get a buy-in, as well as once you have also gotten the stakeholders to even get a buy-in, the advocacy to actually get the taxation actually passed. That's a whole process. And so that's one of the things that can be done. Of course, it's not only taxation that is needed to address SSBs and then the NCDs that are associated. The education must also work and many other things must go on. But definitely we have to start from somewhere. I know that one of the strong things to do in getting the taxation even agreed on is to curate the evidence. The evidence must show clearly that SSBs cause harm, and that's all being done as part of the A4H. So I think that we are starting from somewhere, but there's a whole long way to go in addressing the problem that we have in Ghana regarding NCDs.
Okay. Wise, any short comments?
Yeah, very, very quick ones. Thanks to all the people who asked the questions. The question about the various stages of ripening in fruits, whether I considered them and added something on them in my books. No, I didn't think about that. So you will not find such information. But then whether ripened or not, whether non-fruit sugars or not, they are all sugars. And what is important in human nutrition is what portions you consume. So we advise moderation in their consumption. But I want to throw the advice back to the one who asked the question. Maybe he has done some search or some work in terms of the various stages of ripening. If there's anything significant for us, we should publish it so that we all learn from it. On the recommendation about sugar, the diet alternatives of the sugar sweetened beverages. Yes, there's so much hullabaloo about sweeteners, but then we all know that there are approved sweeteners by the Food and Drugs Authority. And once patients or people consume those fruits in wisely, they should be fine. And these sweeteners or sugar substitutes are widely consumed even by diabetics all over the world. In our own country, they are prescribed and all that. So that's just a little I want to say about that. Thank you.
Dr. Komi, any passion, especially way forward in addition to whatever has been said? Because everything will finally fall on your shoulders.
Together with all team members here.
Yes, of course.
Thank you very much. So briefly about the screening that is done within the churches. We currently do not get that data at our end. However, some steps have been taken. You realize that all these churches ultimately fall within certain districts within the country. And we are linking up with the district health directorates such that they will be able to coordinate at their levels and at least be aware when these churches are conducting screening activities. One other challenge that has come up with respect to this is that we also do not have unique identifiers for people. So it's likely that you are going to have double and triple counting amongst others, because if the person has screened before, there's literally no system that can ensure that they are eliminated from the data. So that's for the churches. Now okay, so I just wanted to also add that as we are interacting with various stakeholders on the SSBs, it's important that we also consider industry players, because there's a huge business side to this. That's ultimately the bane of all our issues with the SSBs. Now, an example with tobacco prevention, ad valorem is currently over 170%, and yet you can still get a stick of cigarette to buy at 20 pesos, because there's a huge industry that is prepared to invest regardless of how much you put in at the prevention side. So it's critical that we're able to convince or engage industry players as well, so that if at least not all of them that might convert, but some of them would also come to appreciate our stand and resort to alternatives. Otherwise, it's quite difficult when you are directly battling industry players in this sense. And that is how come I wanted to chip in that for our partners, we should always also consider the role that industry players have in this. And Prof. Anand, I endorse your message 1000%.
So thank you very much. And just to end, Prof. Lai, can you ask what next in terms of the alliance? What is lined up? I mean, and what should people be expecting? Just as you summarize all what we intend doing and are currently doing.
Thank you very much. So briefly, so this coalition has been working for some time now. We still have a lot to do, evidenced by some of the comments that we are getting from members, public sensitization, but also dissemination of the locally produced evidence on this matter. Most of the time, the questions you get asked are, do you have evidence? If you have evidence, are they locally produced? Is it? And so what we have been doing for the past 5 months is generating local evidence, landscaping analysis. We are doing some economic and modeling analysis that will be useful to the government in terms of revenue generation, about how much would Ghana be getting if we are able to implement these. What are the health benefits if this is implemented? So all those things are being done. We'll continue to do, and we'll be disseminating them. The partners would continue with their advocacy and communication. We'll continue to call on you, especially the government actors, to support this. We are all in this together. If Ghana is healthy, all of us are going to be the beneficiaries, not only just the few partners who are behind this. So we look forward to engaging you, and hopefully once we knock on your door, just as you did tonight, and it's 9 p.m. and we're all here contributing enthusiastically. We are grateful. So we look forward to engaging you in the coming days, weeks, and probably months. Thank you.
Thank you so much. Thank you so much. I mean, it's been a wonderful day and night, and but at the peak, it was over 90 plus in attendance, and I think it just an indication of how people are really interested in the areas. And the take-home message is that there has to be multi-pronged approach where various stakeholders are engaging other stakeholders with different types of interventions, but in a coordinated manner. And that's why and I think James will end it in terms of the program lineup for Kumasi and then Accra and a few other things. But you are definitely invited to other sessions of the Ghana Public Health Association webinars, but we will be looking a lot more on aspects of the the diets, nutrition, and other things, because those are fundamental to risk management, exercise, and other things. And so when you are invited to any of these, you are definitely encouraged to be part of us. And then you can even join the association at a very, very minimal cost. James, over to you and have the closing remarks.
Thank you very much, Dr. Mofa. And by vote of thanks, I want to say thank you so much to our presenters for making time to speak to us, Mr. Lecha, Dr. Kome, Prof. Annan, and then Prof. La. Just to also say that we have some of the coalition members joining us. I saw Dr. Preku, who is one of the leaders from Ghana Academy of Nutrition and Dietetics, that's GAND. I saw Percy, I saw Annabelle, and the others. Thank you so much for making time to join us. And as Dr. Mofa mentioned, there are some activities we are doing as Ghana Public Association. We have 2 floats, one in Kumasi, one in Accra. Hopefully you watch the space, you see the posters and flyers, so you can join us, so we can all create the awareness we want to create to ensure that Ghanaians remain healthy. The presentation will continue to be on our YouTube channel, Ghana Public Association, so you can go there and have it. Once we get to the address also, we may share the presentation with those who sent their email addresses to us. So once again, thank you to all of you for joining, and have a very good night. To see you again in our next webinars. Thank you very much. Good night.
Thank you too.
Thank you.
Good
Thank you and good night.
You hear from us.
Thank you.
Good night, everyone.
Good night. Great presentation. Great show.
Thank you to all. Good night.